Hey everyone, my name's Dustin Kirk. I'm part of Group 6 with Jacob Huff, Anna Myers, Miriam Sanders, and Ryan Wall. And the article that we looked at is called Sleep Enhances Learning of Functional Motor Tasks in Young Adults. It has been shown that sleep can improve simple motor skill learning offline in young adults, but it is unclear what the effect could be on more complex functional motor tasks. Offline motor learning is dependent on sleep, and its influence on motor tasks has not been well studied. Some abbreviations that are used in the study are TUG for Timed Up and Go, PSQI for Pittsburgh Sleep Quality Index, and ANOVA for Analysis of Variance. The purpose of this study was to examine the role of sleep on learning a functional motor task. So, in this study, healthy young adult participants were recruited to be in the study. There were 24 participants that were made up of 11 men and 13 women with an average age of 25.8 years old, and they were randomly assigned into two groups. The two groups were the sleep group and the no sleep group. So what they had the groups do in the study is that the sleep group walked around a pathway at night, and then they performed a retention test in the next morning. The second group, which was the no sleep group, walked around the path in the morning, and they did their retention testing that night. The outcome measures that were looked at in this study were tandem speed, step length, step time, and sleep quality. The Timed Up and Go was used to measure gait speed, and the Pittsburgh Sleep Quality Index was used to measure their sleep quality. The study design that was used was a prospective cross-sectional repeated measures design. The procedures used were that participants had to walk as quickly as they could around a 97-foot long pathway while they were counting backwards by 7, starting at a randomly selected number somewhere between 293 and 299. A gait mat was used to assess spatial temporal parameters. When they were walking across the gait mat, participants had to walk on a marked 5 centimeter line in tandem.
This figure depicts the walking pathway used in the study. The functional motor task consists of walking around an irregular elliptical pathway, with the sides of the pathway marked out by yellow tape. A gait mat was used about 12 feet long within the walking pathway to look at spatiotemporal gait parameters. The participants were instructed to walk as quickly and safely and accurately as possible between the marked yellow lines in the path while performing the cognitive task. When they walked over the gait mat, the participants were instructed to walk in a marked line in tandem. The yellow arrows on the path are going to show the direction that the participants walked, but the yellow arrows were not actually present. The participants were asked to count backwards by 7 out loud. They started at a randomly selected number between 293 and 299, and they were instructed to pay equal attention to both the functional motor task and the cognitive task. The purpose of having the participants walk in tandem on the gait mat and count backwards while walking around the pathway was to approximate walking in a natural setting.
So, as for the results, when compared to the no sleep group, the sleep group showed significant offline learning improvement in performance by demonstrating a significant decrease in time around the walking path and tandem step time, while demonstrating increased tandem velocity and step length. The sleep-dependent offline motor learning score for time around the walking path was significantly correlated with sleep efficiency. Repeated measure analysis of variance used to assess differences in participants and effect size was calculated. So, as you can see over to the right in the charts, all of this is conveyed. After the 6th practice block in each one, there's a 12-hour period of sleep or wakefulness depending on the group, and this is labeled as the retention block. So as we see in chart A, representing time around the walking path, the sleep group showed a significant improvement in time around the walking path after the retention period, whereas the no sleep group did not. In chart B, representing tandem speed across the gait mat, the sleep group once again showed significant improvement after this retention period, and the no sleep group once again did not. In chart C, which represents tandem step length across a gait mat, the sleep group again showed significant improvement with an increase in step length, whereas the no sleep group did not. Finally, in chart D, the sleep group showed significant improvement in tandem step time across the gait mat, and the no sleep group did not after this retention period. So as you can see, the sleep group obviously significantly improved in these outcome measures as compared to the no sleep group. This will be explained further by Jacob in the next slide.
The large effect size of 1.6 suggests a real and meaningful difference between the amounts of changes in time required to walk around the path that were associated with the sleep group participants compared to the no sleep group. The results of the study indicates that sleep enhances learning of a task that is not only complex but also clinically relevant. This walking activity incorporates both motor and cognitive function, including sequencing limb activity, gait, and counting tasks.
Sleep plays a beneficial role on motor skills learned during rehabilitation. Adequate sleep enhances motor learning and can potentially aid in recovery. Even taking a nap after physical therapy treatments can help with the motor learning process and can improve the retention of home exercise programs, further aiding in recovery. There is evidence that suggests ample sleep enhances motor learning in patients recovering from a stroke and in patients with multiple sclerosis. Sleep is commonly disturbed with patients suffering from low back pain, shoulder pain, or post-limb amputations, so it is important for physical therapists to recognize and discuss sleep issues with this patient population. So overall, physical therapists can easily incorporate education about good sleep hygiene into their treatment sessions. Sleep is important for everyone, especially in the patient populations previously mentioned. Because of this, therapists should strongly consider including sleep assessments with their routine examinations. This can help make sure adequate amount of sleep is maintained in patients, which will overall greatly help improve their recovery and outcome.
Thanks for watching, and we hope this has been beneficial for you in your future practice as physical therapist and for use and educational opportunities for the well-being of your future patients.